Hello and welcome back to Newsroom Nigeria. This is where we give you hot, fresh and sizzling news all day long. If this is your first time here or you have not subscribed to this channel, please go ahead and subscribe. Also, give this video a massive thumbs up. That way we're encouraged to put out more reliable and authentic news. And also, YouTube is able to recommend this video to other YouTube viewers all around the world. Lastly, please leave your opinions in the comment section below. Senate President Godswill Akpabio appears not to be bothered by the misfortune of Nigerian small businesses already buckling under economic pressure, as he has extended a fundraising appeal to them. Despite millions of businesses shutting down in the past year, Akpabio's office has dispatched letters to struggling small businesses requesting financial support and resources for his upcoming medical outreach in Nasarawa West Senatorial District. A copy of the letter sent by the Whistler and addressed to a business owner based in Lokoja, Kogi State, contains appeals ranging from the supply of medical personnel and equipment to financial donations. The letter, dated April 24, 2025, was signed by Mr. Olanipeku Ogunsolire, Special Advisor to the President of the Senate on Human Capital Development, Humanitarian Affairs and Digital Economy, who confirmed to the Whistler that the letter emanated from the Senate President's office. Ogunsolire, however, noted that the letter was not meant for the public. The Whistler reports that Akpabio's request for support comes at a time when the business sector in Nigeria is in distress. According to the Nigerian Economic Summit Group, approximately 7.2 million of the country's estimated 24 million MSMEs shut down operations between 2023 and 2024. Dr. Segun Omishaki, Chief Economics and Director of Research at NESG, reviewed the statistics during the launch of the 2025 Private Sector Outlook in March. He noted that Nigeria also suffered an estimated 94 trillion naira economic loss due to multinational divestments and business closures during the same period. Meanwhile, a source at the Senate, who also confirmed the letter, questioned the appropriateness of seeking contributions from struggling businesses, considering the hardship they are facing. The outreach, scheduled to commence on May 14, 2025, will cover the 6 local government areas in the Nasarawa West Senatorial District, comprising Nasarawa, Akwanga, Karu, Kefi, Kokona, and Lafia. The Senate President's office, in the appeal letter sent, said the initiative seeks to improve access to health care in undeserved communities and will focus on vulnerable groups such as women, children, the elderly, and those excluded from the formal health care sector. The outreach includes general consultations, treatment, distribution of essential medications, eye care services, minor surgical procedures, maternal and child health care, and public health education. The letter partly reads, "I write to respectfully request your esteemed organization's support for comprehensive medical outreach being organized by the Office of the Senate President across the 6 local government areas of Nasarawa West Senatorial District, namely Nasarawa, Akwanga, Karu, Kefi, Kokona, and Lafia, starting from 14th May 2025. This initiative is part of our broader commitment to improving access to quality health care, particularly in underserved rural and peri-urban communities. Many residents in the region continue to face significant challenges, including limited medical infrastructure, economic hardship, and a shortage of qualified health care personnel. The planned outreach will offer a wide range of free medical services, including general consultations, treatment, distribution of essential medications, eye care services, minor surgical procedures, maternal and child health care, and public health education. Our primary focus is on the most vulnerable groups: women, children, the elderly, and those excluded from the formal healthcare system. In light of this, we kindly appeal for your organization's support in any of the following capacities: provision of medical personnel such as doctors, nurses, and laboratory technicians, supply of medicals, medical equipment, empowerment consumables, personal hygiene essentials, development and distribution of health education materials, logistical and technical support, or financial contributions and grant assistance. Your support, regardless of the form, will make a significant difference in the lives of thousands and contribute meaningfully to our shared goal of advancing universal health coverage in Nigeria. We would welcome the opportunity to meet with your team to further discuss areas of collaboration and align on implementation. Please find attached a brief proposal outlining the outreach schedule, target demographics, and expected outcomes. Thank you for your time and consideration. We look forward to your positive response and to working together to deliver this important intervention. Speaking to the Whistler on why the Senate President's office was turning to businesses for support, Ogunselere said, "This is not something that we are doing publicly yet, because what we are trying to do is work with potential partners. It's a medical outreach that's meant to be taking place. We are trying to see how they can support the initiative. The initiative is actually with primary health care. So what we are doing is supporting the local area. We are also trying to get well into the communities, and that's what the Senate President is looking to do. So in terms of what we are doing with our letters, we are trying to reach out to the organizations and other agencies and international bodies that can help to see how we can support the outreach that is already taking place. So we are aligning with an outreach." Ogunsolire added, "Our goal as an office is to make sure that we can bring all parties together so that when they are all together, we are all serving the same purpose in terms of working for the people. So it's for us to bring people together and make sure that we effectively utilize resources in terms of manpower and everything else." Asked if the initiative would not be interpreted as adding burden to anyone struggling businesses, to already struggling businesses, Ogunsolire said, "No, not necessarily, because we are not forcing it. It's not a force on anyone, nor is it a requirement. We are saying if you would like to partake, if you would like to help your community or be involved in what the outreach is about, then by all means, we would like to listen to you. So it's not something that's imprinted. There are other organizations and private bodies that are willing to help, and then, of course, we look to do that. So we help to lend and support and promote them for what they've done for the communities." Ogunsolire stressed that we are not making it public yet because we want to see if this is something that people would want to support. But in the meantime, we are working to see how much we can, if we can support, and it's not something to make noise about, because that's not what I believe as a department. It's something to ensure that the people get the benefits. Now, obviously, on the day, if it's out there and people are talking about it and things like that, that's fine. But for us, it's doing the groundwork. When asked why the choice of Nasarawa, Ogunsolire responded, "We are looking at all different communities to engage with. It's not just Nasarawa, but we are starting here because it was something that they reached out to us about." You all, let's have your total opinions in the comment section. Thank you very much for always listening and watching. I will see you all in my next video. Bye for now.